A very good morning. Welcome to Sky News Breakfast. Our top story this morning. We start with a warning to teachers from the government that they will need to merge classes and reintroduce hybrid learning in order to deal with staff shortages caused by the spread of Omicron. Schools around the UK returned this week from the Christmas holidays. As ministers predict mass staff shortages this month, News 2 this morning of a critical situation at hospitals in Lincolnshire. More on that in a moment. First, let's bring you up to date with the key developments on schools. The government has already said that secondary school students in England will need to wear masks in lessons from tomorrow and promised to provide 7,000 air purifiers to schools to help classroom ventilation, but there's concern it may be February before some schools get them. The Education Secretary is now urging schools to prepare for the merging of classes into larger groups and to be ready to introduce a hybrid of face-to-face and remote learning if there aren't enough teachers. He's encouraging the use of temporary and supply staff to cover classes. The government is also advising that all secondary school students should undertake one on-site test when they return to school, and that all students should take 2 lateral flow tests at home each week after that. It comes as the Labour Party said that 500,000 eligible 16 and 17-year-olds across the UK remain unvaccinated, more than 4 months after the government said they'd be offered a jab. Oksana Pryzik, an epidemiologist at UCL, told us the proposed measures are a good start, but a greater focus on ventilation is needed to prevent the spread of Omicron in schools.
No one is saying that masks alone will be the only solution. In the UK, we've also introduced 7,000 new filtration devices, which is a good start. But we've been calling for better filtration for, over 2 years now. So more can be done to ensure that every school has appropriate HEPA filters installed that can remove these aerosols very effectively. The evidence is now there to show that this is one of the most effective ways.
Well, I'm joined now by the Education Secretary, Nadhim Zahawi. A very good morning to you. Thank you very much indeed for joining us. Can I first begin by asking you the data on Omicron? How many patients are in hospital at the moment with the Omicron variant?
Good morning, Sally. So the data is obviously published daily, and the hospital numbers of people in hospital with coronavirus has begun to rise in the over 50s, which we are concerned about. But on the whole, actually, the number of people in ICU has come down, which is good news. But we keep a very close eye on those numbers, and those patients in hospital at the moment is very important.
Do you know how many of those patients with Omicron are on ventilators at the moment?
I don't have the data with me on those on ventilators, but on the whole, we're not seeing the same pattern as with Delta, where we had a much greater number of people on ventilation, and there seems to be a shorter period of time of people in ICU as well, and those who are being admitted with COVID rather than for COVID is also about a third of that number.
Now, the Minister, Stephen Barclay, yesterday said that the data doesn't support the need for any new restrictions. Of course, Plan B is being revised on Wednesday when ministers return, when Parliament returns. Is it fair to say that we can expect nothing to change, that no restrictions will be lifted, but nothing will be added either?
Well, the review's on Wednesday, and at the moment there's nothing in the data that would suggest to me, to us, that we need to go further. But we have to be careful with that, because obviously if we see more leakage of infection in the over 50s, because most of the surge in infections from Omicron has been in the under 50s, then there is more likely that those people end up with severe infection and hospitalization. But the good news is, obviously, that 90% of those people over 50 have had the booster jab. That is the real protection against severe infection and hospitalization. So at the moment, there's nothing in the data to suggest that we need to go further. But of course, we will look at Wednesday's review, and then beyond that, keep monitoring the data very carefully.
Now, of course, many schools return tomorrow. Secondary school pupils have been informed they need to now wear face masks, and that every child returning to the classroom needs to take a test before they do. Now, there's not been much warning. This was announced yesterday. Most children go back to school tomorrow, 48 hours notice, including a bank holiday. Will schools be ready with all these tests?
Sally, actually, on tests, and I want to thank school leaders and teachers for everything they did last year, where we had 99.9% of schools open. I deliberately, before Christmas, made sure that we had an alternative supply for schools for the testing that we will be conducting this coming week in secondary schools. And that has really gone down well with the head teachers, with teachers, that we've got that supply in place. We also anticipated the staff shortages, and I had a call to retired teachers, those who can come back to the profession. A number of my colleagues, Jonathan Gullis, Caroline Ansell, Sir Michael Wilshaw, a number in my department have come forward to join that effort. That I refer to as a sort of that blitz spirit of joining in to make sure that the first week of term and then subsequent weeks are really positive, and we get as many children back in school, back in education as possible, because all the evidence, you look at what Rachel D'Souza, the Children's Commissioner's survey, the big ask, suggests that children are much better off being in school for their health, for their well-being, and of course for their education, which is why it's my priority to make sure that those tests are conducted and we have plenty of support for that and supply, and of course the staff challenges and ventilation, because we distributed 350,000 CO2 monitors last year, and looking at those, I wanted to make sure that we had initially 1,000 air purifiers that we bought last year for special schools, which are the most vulnerable, and for alternative provision schools. I've just added another 7,000 air purifiers for those schools who can't mitigate if the CO2 monitors are suggesting that they need to open windows or have better ventilation. Those 7,000 air purifiers will help with that as well. So this is a big effort on behalf of everybody on the front line. I want to thank them and the support staff, of course, for everything they'll do this week, so we can get a school reopening being incredibly positive, and it's absolutely the right thing to do. So I think the mitigations we've put in place are the right ones. On masks, I don't want them...
Mr. Zahawi, if I may just jump in there on that issue of ventilators, the 7,000 extra that have been announced. Sky News has learned that many of those won't actually be in schools until February. Is that acceptable?
So we had 1,000 before Christmas for the schools that are special and AP that will most need them. By the way, the thing to remember, the 350,000 CO2 monitors that we distributed to schools allow them to monitor the atmosphere in the classroom, and the additional 7,000 are really there to help if those schools need that additional purifier. On the whole, the response we've had back from the data from the 350,000 CO2 monitors has been incredibly positive, that most schools can actually deal with this through other measures like opening windows and, of course, better ventilation.
Good to know. Let's just rattle through a few more questions, because there's quite a few things I'd like to get through, if I may. Just on the issue of testing, you want pupils to take 2 lateral flow tests each week after their initial test when they return to school. What happens if parents can't access lateral flow tests next week? What do they do?
So one of the things that we've done is increased the supply of lateral flow tests. So it was about 100 million a month. It's now 300 million a month. And the deliveries. So we've trebled the deliveries from about 300,000 a day to 900,000 a day. So the supply will absolutely be there. If people feel that they can't get the supply, they should just refresh their web page, and it is pretty much delivering with that additional supply coming through. For school testing, I deliberately chose to make sure that we had a different route of supply for the schools, which I'm confident all schools have now for this week for their testing that they need to carry out for the secondary school pupils to be tested and feel safe in class.
Next thing, merging of classes. You gave head teachers warning yesterday. Pupils are returning tomorrow. What does that mean for children and teenagers now facing GCSE and A-level exams this year, perhaps without their usual teachers having to merge with other year groups? What would you say to those children? Are contingency plans being made for GCSEs and A-levels not to go ahead once again this year?
Well, first of all, exams are going ahead this year, this summer. There's also some exams, by the way.
But that was also said last year, and they didn't.
As I said, I think there's a big difference from last year to this year. Last winter, January, I was the vaccines minister, and we had no vaccines pretty much, or no one vaccinated. We only had very few people vaccinated on the beginning of the 8th of December of the year before, and only on the 4th of January of last year did we begin to scale up the vaccination program with the AstraZeneca vaccine. So very big difference. We now have 34 million boosters on top of the 100 plus million of people who've had both doses, 50 million of each dose. So we're in a very different place in terms of the vaccination program. Okay. We have also, I think, been working really positively with the front line, with teachers, head teachers, to make sure that they have the test kits in place. The exams will go ahead. The merging of classes is really a mitigation against staff shortages. But I think the first thing to do is to make sure that we work with the supply companies of temporary staffing, which I've been doing, obviously, with the call to get people to come to help out if they are retired teachers.
How's that going? How much uptake has there been?
So by the end of this week, I'll be able to have that data, because obviously the temporary supply companies will be able to then give us much clearer data on that. We were running at about 8% staff absences at the end of last year. And of course, we are looking at different levels of staff absenteeism and what those mitigations mean, including, as you say, if they need to merge classes. The most important thing for me is to make sure children are in school with their teachers in the class learning. Yeah. And of course, we'll do everything in our power to make sure that happens.
And just on that issue of absenteeism, Mr. Zahawi, with the government preparing for potentially 25% of the workforce being off this month, have you also discussed the issue of potential school closures with head teachers?
Well, as I say, the priority is to keep schools open. 99.9% of schools were open at the end of last year, and I hope we can continue to make sure that that happens. The testing, the staffing, support we're putting in place, and of course the ventilation is going to make a big difference to schools this year. The most important thing is to keep them open. We obviously plan for all sorts of measures. We monitor staff absenteeism. I just said to you, we're running at about 8% last year. If that rises further, then we look at things like merging classes, teaching in bigger numbers.
Another quick question, if I may, Mr. Zahawi. We don't have long left, my apologies. Israel has started administering a fourth vaccine, a fourth jab. Is this something that we could see happening here in the UK before long?
Well, we have fantastic capability in terms of looking at the clinical data in terms of waning of antibodies or T cells. And I'm sure the team, whether it's Chris Whitty or Jonathan Van Tam, and Sajid Javid, will be looking at that and whether we need to go for a fourth jab. At the moment, the focus is on the booster campaign, rightly so, because we know that boosting is the best way to protect yourself, your community, and of course your family. So get boosted if you haven't had that yet. But we monitor the efficacy of the vaccines very closely in the UK, and we're very fortunate to have great scientists who do that work for us.
OK, Education Secretary Nadeem Zahawi, thank you very much indeed for your time today. Thank you.
Thank you.
And we can take a look at the latest daily COVID data released by the government now. 137,583 new cases have been reported in England and Wales. The number of cases has been affected by a processing issue, which inflated the number of positive tests reported on previous days. 73 deaths were recorded in England and Wales, bringing the total number of deaths within 28 days of a positive test to 148,851. The secret settlement between Prince Andrew's accuser Virginia Giuffre and Jeffrey Epstein is due to be made public later today, and we can speak to our Sky correspondent, Enda Brady. A very good morning to you, Enda. What can we expect?
Well, all eyes on a courtroom in New York later today when this secret document, which was signed and sealed in 2009, will be made public. So it's a document, basically a settlement between the billionaire paedophile Jeffrey Epstein and the woman who accuses Prince Andrew of abusing her, Virginia Roberts Giuffre. Now, Prince Andrew denies all of the allegations. This is a civil action in the United States. His lawyer is a man called Andrew Brettler, and he has previously told the New York hearing that this agreement releases Prince Andrew and others from any purported liability arising from the claims Miss Giuffre asserted against Prince Andrew here. It's being heard by a judge, Lewis Kaplan. He's presiding over the civil case. He will tomorrow hear a video telephone conference. He will preside over that tomorrow. Andrew's team trying to get the case thrown out. As I say, he denies any wrongdoing whatsoever. We've no idea if he will be following proceedings from here, but his legal team will be right across this. And of course, speculation over the weekend that conversations have been had behind closed doors at the highest level in the royal household about what to do if Andrew were to lose this civil action in the United States. Some speculation that he could be stripped of his title, the Duke of York, and calls today from veterans for him to step back from the 9 military titles he holds in various different regiments, including Colonel-in-Chief of the Grenadier Guards.
OK, Enda, for now, thank you. Also making the news this morning, an Irish woman injured in an accident in the United States 7 years ago has died. 27-year-old Aoife Beery suffered serious injuries when a balcony collapsed during her birthday party in California in 2015. 6 other people were killed in the accident. Twitter has permanently suspended the personal account of Republican Congresswoman Marjorie Taylor Greene for repeatedly breaking its COVID misinformation policy. Ms. Greene was flagged after posting false claims about deaths caused by vaccines. She called the tech company an enemy to America. President Biden has told the Ukrainian leader Volodymyr Zelensky that the United States will respond decisively if Russia invades Ukraine. Last week, Vladimir Putin warned Mr. Biden not to impose new sanctions on his country. Ukrainian officials say more than 100,000 Russian troops are now positioned on their eastern border. Countries across Europe continue to change their travel restrictions for visitors from the UK. Our Europe correspondent, Adam Parsons, joins me now. A very good morning to you, Adam. What changes are on the horizon now?
Yeah, it's an interesting one for Europe because there is a patchwork of restrictions. And this happened last year as well, is that what the European Union would like is to have one unified approach, and they're getting nothing like that. Yet some countries which are pretty lax in their controls or accommodating, you might say, others which are being very strict. I think as a general rule, travelling across Europe now, if you're coming from outside the European Union and you want to go to an EU country, you probably will need to have proof of full vaccination. But then once you get into the doors and you have to use some pass to show that vaccination, well, that applies in many nations across the East and West. Now, what's happening today varies from country to country. Germany, which has a very strict rule against people coming in from the UK has backed down on that now. So if you are coming from the UK to Germany, you can now get into that country without facing the same lengthy quarantine that you would have done over the Christmas and New Year period. France, though, still has rules that make it very, very hard to get in there if you're coming from the UK. Frankly, makes it very hard, actually, at the moment to transit through France. They've allowed leeway for people who are coming from the UK and may have residency in another EU country who need to go through France to get to that country. For a while, it seemed as if the French were stopping that happening. They've now said you can do that during the Christmas New Year period. Don't know when that's going to come to an end, but restrictions in France introduced as of today on bars, on the nighttime economy, and also saying that people really do need to work from home more. We've seen a very, very significant rise in the number of Omicron cases in France over the past week or so. And for an example, let's look at Greece, which now has said that those sort of high protection, those FFP2 masks are now mandatory in supermarkets and other settings. There are moves up and down, but the general feeling in the EU, I think, is that things are being tightened once more.
OK, Adam, for now, thank you. And Israel has announced it will give a fourth coronavirus vaccine to everyone aged over 60. Health officials there have warned, despite a high uptake of the jab, they are seeing a big increase in the new number of Omicron cases. Hello. Hospices caring for terminally ill patients say they're facing a cash crisis because of a lack of fundraising events. The care they provide is funded by donations, and thousands of regular charity events have been cancelled because of the pandemic. Sky's Charlotte Lomas reports.
This beautiful building is actually a hospice, providing critical care. Staff here in Romford, Essex, treat patients with life-limiting conditions. The demand for this has risen significantly. Funding, however, has not.
The situation is that we're in a financial challenge because we only get 30% of our funding from the NHS and the rest we have to fundraise. And that has been exceptionally difficult through COVID times. So one call is help, we need more money. And the other is for frontline staff. We need to recruit more to cope with the increase in pressures that we're under.
You want hands and legs? Yeah.
Calvin Haddo has a chronic inflammatory lung disease. He could manage his condition at home but requires regular treatment. He's keen to show how the hospice provides much more than end-of-life care.
When I got here, so it was totally different from what I'd expected. It was a very positive place. I mean, I know hospice by very nature of being a hospice. People do die here, but a lot of people don't. And that's the important thing. When you come in here, it's not a feeling of gloom and doom, far from it. I learned to live again to some extent here, you know, I really did.
The hospice needs to raise £8 million a year to carry on supporting patients, and not just those on the ward. The vast majority, almost 85%, live in the community. Kate Marling is one of a team of nurses who visit them. She worked throughout the pandemic ensuring patients could stay at home and be with loved ones. She says people need the hospice more than ever.
It's a 24-hour service, so as well as going out during the day to support people and their families at home, we also have a 24-hour advice line that a nurse will always answer. And the reassurance and comfort that that gives to people is huge, and we need to be able to continue to do that.
The Department of Health and Social Care has said it's incredibly grateful to hospices for their ongoing work. A cash boost of £32 million will be provided over the next 4 months. But hospices are worried about what happens when that runs out. For now, they're lifting the financial load, taking the pressure off the hospitals. But hospices need continued and guaranteed funding to carry on. Charlotte Lomas, Sky News.
Also this morning, a coach at one of Canada's biggest hockey teams has thanked a fan who told him to see a doctor after spotting a mole on the back of his neck. Medical student Nadia Popovici was sitting behind the Vancouver Canucks dugout when she wrote a message on her phone and showed it to assistant equipment manager Brian Hamilton.
Hi.
Hello.
Hi, it's so nice to meet you. Are you okay with shaking hands?
Yes,
or hugging?
Thank you so much. Thank you.
The two of them have now been reunited properly after being removed. The mole was found to be cancerous. Brian then tracked down Nadia after an appeal on social media for supporters to help find her.
I really don't, but
The government says the data on COVID cases doesn't currently point to the need for fresh restrictions. With news, the so-called Plan B in England is to be reviewed on Wednesday. Here's what Education Secretary Nadeem Zahawi told me a little earlier.
At the moment, there's nothing in the data that would suggest to me, to us, that we need to go further. But we have to be careful with that because obviously if we see more leakage of infection in the over 50s, because most of the sort of the surge in infections from Omicron has been in the under 50s, then there is more likely that those people end up with severe infection and hospitalization. But the good news is, obviously, that 90% of those people over 50 have had the booster jab. That is the real protection against severe infection and hospitalization. So at the moment, there's nothing in the data to suggest that we need to go further. But of course, we will look at Wednesday's review and then beyond that, keep monitoring the data very carefully.
And our political correspondent, Tamara Cohen, is in Westminster for us. Hello to you, Tamara. So despite it looking likely before Christmas that there could be more restrictions, that may not now be the case.
We have seen a bit of a shift since the run-up to Christmas, Sally, and I think there is great optimism in government now that more restrictions in England will not be needed, certainly will not be needed in the next few days. What's called Plan B, the guidance to work from home and to wear masks indoors, will be reviewed on Wednesday when the Cabinet meets, and I get the sense that they'll keep most of that in place for now, but probably won't add any more restrictions in England other than what the Education Secretary set out in particular for secondary schools as they reopen this week, which is increased mask wearing at your desk in the classroom. You'll have to wear a mask, and they want every single secondary school pupil to take a lateral flow test on site before they return to school to try and slow the transmission there. But other than that, it doesn't look like there will be restrictions on social mixing in England announced soon. But Nadeem Zahawi did sound a note of caution there that while the Cabinet will be very carefully looking at the hospitalisation data in London over the next couple of days, some of that data has been disrupted over the Christmas period, to see where we are in terms of hospitalisations. One of the key indicators is how many older people are now getting Omicron, it having been a surge of younger people initially, because those people are more likely to get severe disease. So the hospitalisation data, but obviously combined with how many NHS staff are off sick with COVID, because although we have fewer people in hospital than we did this time last year, the huge numbers of infections means that you've got something like 1 in 10 NHS staff off sick, which also adds to that pressure. So they'll weigh it up very carefully, but the feeling in government is optimism at the moment that more restrictions won't be needed.
OK, Tamara, for now, thank you. Well, with the ongoing warnings of staff shortages and problems in schools because of Omicron, the race to vaccinate as many people as possible against the virus continues. And we can speak now to Dr. Emil Mehta, a GP. A very warm welcome to you. Thank you very much indeed for joining us this morning. Now, you work in Redbridge, if I'm not mistaken, a borough with one of the lowest vaccination rates in the UK. What are you seeing in terms of the impact that's having?
Good morning to you. So the last several months has been extremely busy. We've seen the initial sort of cohorts being vaccinated. We're now in the booster campaign in Redbridge. And life has been busy. We've been vaccinating in our practice up to 300 or 400 people every day. So I think that's our real challenge in terms of what we how we come out of this, and the real sort of notion of the race against the vaccine is. It couldn't be truer. I think this is an absolute critical time in the pandemic, and the more we vaccinate, the better, the greater chance that we have of getting out of this pandemic sooner.
Now, we were speaking to the Education Secretary on the programme a little earlier, and he said there is now data to show that there is an increase in infection of Omicron in the age group of over 50s. It was younger people before. How much does this concern you, and is this what you're seeing too?
Well, it is concerning. I think the concern is that does this new variant have greater severity of disease in older people? And if it does, what impact does that have on our NHS? I think it's too early to see what's happened in the last few days in terms of the numbers that have been admitted to hospital, etc. But I think what we're concentrating on in primary care and general practice is to vaccinate as many people as we can throughout the next few weeks.
And of course, an NHS trust in Lincolnshire has now declared a critical incident because of staffing shortages there. 1 in 10 members of the NHS workforce off work on New Year's Eve. Are you seeing a pressure on the NHS in terms of absenteeism, and how concerning is that to you?
Well, that is concerning. I think the infectivity of this virus is clear. Not only do we have a concern about the absences, but we've got an exhausted NHS workforce who have been at this process over the last couple of years. So I think we've got to bear in mind that staff are absolutely exhausted with increased infection rates. I think we've got to be careful, and we must not forget the sort of routine work that carries on in general practice and primary care, looking after the chronically ill people anyway. So yes, I am desperately concerned, but I think we are more hopeful than we were in December 2020 when we started the vaccination programme outright. So yeah.
Now, with schools returning tomorrow, more than a third of 16 and 17-year-olds eligible for the vaccine haven't taken it. How much does that concern you?
It is concerning, although I must say that, over the last couple of weeks, we've seen more younger people come up to the practice to be vaccinated. So I think the next few weeks are really, really critical. We've got to encourage our youngsters to get vaccinated. We know that this is a easily spread virus. It's a respiratory virus. So let's encourage all your listeners to get vaccinated. And the younger cohorts, the school-going children, are absolutely critical to get done also.
But of course, COVID doesn't have a serious impact on most teenagers, and many may feel they don't need to have the vaccine. They'd rather get immunity naturally from catching the virus. What would you say to them?
I think the concern is really that, you can be an asymptomatic carrier, and if you are a child going back home to older parents, etc., older grandparents, you may be the cause of passing on infection to them. So, yes, younger children may not be severely affected, but they may carry the virus onto households.
OK, Dr. Emil Mehta, thank you very much indeed for your time today. We wish you well with your work this winter.
Thank you.
Welcome back, and with us now to review the papers this morning are broadcaster Pete Price and journalist and author Genelle Aldred. Hello to you both again. Thanks again for joining us. Now, we're going to kick off with you, Genelle, first. The Mail you've picked out today, the pressure on the Prime Minister over soaring energy bills.
Yeah, I think fuel poverty is something that we talk about many years, but this year we could see the cap of the bills rising to around £2,000 a year. Now, Boris Johnson is under growing pressure from his backbenchers to scrap the green taxes that add around £200 a year, and also to honour a Brexit campaign pledge to scrap VAT, which would be another £60. Now, although £260 might not sound like a lot to ministers, some of whom are on £3,000 lunches on our dime, it is a lot for families, and I think it's really important that we take a look at the most vulnerable amongst us, because they'll be the ones most hit, the elderly and then children. And this leads back into the conversation around things like lockdown, furlough. If we do this, how that affect people's money, people's bills, because we don't want anyone to go cold. I think in a country of our size and our economics, it is a shame if people have to go without fuel just to save some money.
Yeah, Pete, what's your views on that? What are you hearing up in Liverpool from people about the cost of soaring energy prices? They have just risen astronomically last year.
People are very frightened, and it really is a scary time to keep warm, and so many people will leave the heating off, will not use the gas, will not use electricity because they're frightened. And they'll be frightened by this story as well. And they'll start thinking, what are we doing? What can we save money on? The government have got to step in on this. We hear about all these subsidies towards new fuel ideas. They've got to give something back. We've just been through a pandemic as well, so we don't, and we still are in it. We need people to be warm in their homes because that's all they've got. So many people still are frightened to go out, especially the elderly.
And Pete, that perhaps plays into this story as well that you've picked out in the Eye today, that the pandemic has created a tsunami of anxiety, it's being described as. But of course, the cost of living is, I'm sure, not helping with that.
This story is really, really depressing. It's saying there's 700 doctors and frontline staff are asking for help, crying out for help with their mental well-being. And we've got to remember also the ambulance, fire brigade, police, who also had to deal with this and had to go and help people because of the lockdown. And what upsets me most is that mental health situation in this country is not brilliant anyway. The help for it, there's people on waiting lists waiting to see people for months and months and months. So if these poor doctors and frontline staff are suffering, I mean, I couldn't work in a hospital anyway. I don't know where they get their amazing ability from, because the A&E just up the road from where I live now is busy, very, very busy. A friend of mine's just been taken into hospital, not with COVID, but they're there for like hours on end, and the staff are just exemplary, just so good. But I don't know how they deal with their health, and I don't know what's going to happen. And it is a tsunami.
And Genelle, just your views on that as well. This article really is quite shocking in the way it describes what NHS frontline staff are going through. And of course, we're seeing the high numbers of absenteeism at the moment in the NHS as well. And this, I'm sure, is not helping.
No, it's not. And you can see, or, I can see as I have a day job and go back to work and talk to people, just the levels of anxiety people have about re-entering life, re-entering society. Even me, I had a panic attack driving my car on the motorway after lockdown ended, and never before have I had any issues driving my car. So the people at the front line seeing all of this, we can't think that they are somehow not affected by seeing how affected all the patients they deal with are. And I think we also really need to consider not only just absenteeism over COVID, but over their mental health and how we look after them so that we don't continue to burn them out in such big numbers.
And just leading on from that article in the Eye describing a mental health crisis among frontline doctors and nurses, you've picked out another article which describes vulnerable children waiting years for mental health services.
Yeah, and if we think, adults aren't coping well with a pandemic, what about children with their, fully formed minds in that sense? So in South Yorkshire, in one case, a child waited 3 years for some mental health support, and in Staffordshire, 7 days, and in Bromley in South East London, it's on average around 3 months. Now, the lengthy wait to see and seek help means that more children end up actually in crisis, because by the time they see someone, those issues worsen and worsen. And there's a story about a young girl whose mom had moved away and she's studying for her A-levels, very much isolated and alone. Now, the NHS have proposed seeing people within 28 days of a referral, but clearly that is not happening. And then alongside with that, there's the shortage of beds. That means some children and young people are often on adult wards. There is a whole circular situation and disorder in the NHS. And I think the government really need to get a handle on this and sort this out.
Certainly in that article, it is being described as a scandal. Pete, just moving on to a slightly different pandemic-related story. Dutch riot police clashing with anti-lockdown protesters. That, again, being reported in The Independent.
Indeed. Can I just say, though, to add to what that lovely lady has just said, parents should do more by taking their children off computers off phones and get them talking, human beings talking to human beings face to face. That will help an awful lot with mental health problems. And then going over to Holland, wow. My favourite people in the world are the Dutch. I'm surprised at them rioting. There's another lockdown. We all want to get back to normal, but I don't think rioting is helping. And the cost of managing this riot, and we've seen the pictures, a lot of people very angry. These probably are the people that are anti-vaxxers as well, so they're not helping anybody at all by being anti-vaxxers. But I love the Dutch, and I'm surprised at this, and it's very sad, and it looked quite brutal. Hundreds of people on the streets saying, we're not going into a lockdown again, we don't like it, we don't want it.
Briefly from you, Genelle, on that. It's not just anti-vaxxers who are protesting. Do you think that perhaps there is just less goodwill this time in terms of changing your life and locking down and being willing to accept restrictions?
People don't generally, I think, want to be stuck in their homes. And I think also, I mean, can't say about there, but in this country, definitely the government have had their part to play in people not wanting to be locked down again because people feel it's one rule for us and one rule for them. I think so much has happened in these 18 months with families not being able to be together in some of the best and worst moments of life, people passing, lack of being able to mourn that and be together in those times. And then we see, you know, I hate to bring it up, the cheese and wine gate and all the other stories that come out. It makes people reluctant to follow the rules. And I'm not saying that it's right, but I'm saying that the way human behavior is, the way people are, is that we tend to not want to do things if the people telling us to do it are not doing it themselves. And I think that has played a lot into the public psyche around lockdowns. Okay. And so I think our government have to take their share of the blame.
I'm so sorry. I'm going to have to interrupt you because I really want to get to this story before I let you go, of the hockey player who was saved by a fan when she spotted his mole. Please, quickly, tell us about that. It's a great story.
22-year-old ice hockey fan saw one of the coaches of a hockey team. He had a mole on his neck. It looked cancerous to her. She'd volunteered in cancer wards. She wrote him a note on her phone, stuck it up against the glass. He said that when he saw it, he was mid-game, so he kind of shrugged it off, but did go and get it checked out. 3 days later, he's told that left years, it could have been life-threatening. They tracked her down on Twitter, and then they also gave her $10,000, which she's going to use to help her get to medical school.
And she is being described as a hero, as are you both, Pete Price and Genelle. We will see you in the next hour. Thank you very much indeed.